So we're going to basically, I'm going to give you a little overview. There are going to be 2 sessions today. The first one's today at 10:30, and then we're going to have another one at 11:15. We've done this so that it's like just 30 minutes of just giving you an overview, and then 15 minutes for you guys to network with the individuals in this room. We've got Todd McBride from CSUB, Dr. McBride. We have Matt Constantine from the Kern County Health Department. He's the director. Sal's going to be talking from the master's program from UCLA, and then Lindsay Rice from UCLA too. And then we have Dignity here too also. So we're going to be really talking about the different careers in public health, but really also talking about a great opportunity that UCLA has that I'm really excited about. So I just wanted to show you this page. This is a website page. It says Public Health Sciences. It has a great video that my students put together. It has the degree plans, because I often get asked what degrees are there in public health, and I'm going to just hit on them today, but you really should explore this website. And then I get asked this question a lot. Matt does a lot too. What careers are there in public health? And so I interviewed some of the people from Kern County Public Health Department, some of my students, and we're going to be putting up videos. You can look at these videos here in Career Ladders. Here at BC, we're going to have 2, what I call kind of like a pipeline stackable certificate with an AST. And I'll tell you a little bit about this AST. It's an Associate Science Transfer degree. The Health Navigator is going to be a certificate of achievement, which is all the public health science classes, which are 4. So if you see on your brochure on the back, there are 4 public health science classes, plus an internship with a community partner with a capstone project. And then also a few more classes, and that will be rolling out in fall 2018, but you could start your classes now. The second option is that builds into something called an associate transfer degree. And the idea is that you would take your science classes plus public health and then transfer to a 4-year institution like CSUB or UCLA, or transfer to another place and continue to build, because people in public health will tell you that having a firm background in the sciences and having that 4-year degree and beyond really does help you grow in the career. So those are 2 options that can get you started at BC, but you can also get employed in public health. That's important too, because ironically, public health also wants you to have boots on the ground experience. So you can't be pure academics, you gotta have experience too. Those 2 things are really important. We wanna see you be able to work with people and interact and really get enthused and excited about this. So this will give you career experience, but then also the academic part, the pipeline part, okay? So that's something that's in place right now, and this is coming in the fall. But I want to tell you that that we are also really boots on the ground experience, and this is something that happened last spring. We had something called a hackathon, where an app, they do technology and apps built together to find solutions. So we work a lot with computer people too. So you have to understand that public health isn't all medical field. There's computer analytics, a lot of it. There's environmental health sciences. There's a lot of different career options. And this is a contest, and the first place was a mental health app that really did screenings to get people in. Building healthy communities. Right now, there's a service project that's happening with internships right now, where computer students and science students and health science students are developing an app. So I just want to tell you that it's experience happening right now. So with that, I think the big bulk of the day, I really wanted to focus in on the UCLA opportunity. So I wanted to kind of plant a seed for you to understand that you could start things here and then get a job if you want to, a career pathway, or you can also at the same time continue to build your academic career. So with that, I'm going to pass this over to UCLA, and whose presentation is right here. And Lindsay, I'm going to give you the reins, and then I'm going to switch this out because we're recording this. So go ahead, go for it.
All right, thank you. So
There you go.
All right, everybody. So go ahead and stand up if you have ever had to or know someone that has had to translate for their mom, dad, or family member at the doctor's. Go ahead and stand up. All right, everyone sit down. Stand up if you ever had to or know someone that has had to stand in line at school for those free lunches. Go ahead. Everyone sit down. Stand up if you have ever suffered from asthma or know someone that suffers from asthma. All right, everyone sit down. Exercise. Stand up if you know someone who has experienced a teenage pregnancy. Okay, everyone sit down. Stand up if you know someone that has received treatment for mental health. Everyone sit down. Stand up if you have ever heard about breast cancer screenings. Sit down if you have ever washed your hands.
Who's standing?
Right. Stand up if you ever drink water. Good, hopefully. Sit down if you have ever had to participate in an earthquake drill. Stand up if you have ever used a seatbelt. Sit down if you have ever eaten a fruit or vegetable. And stand up if you have ever eaten at a restaurant.
And sit down if you realize I will just trick you into doing crooked
Well done.
Well, although all these things that I mentioned do seem a little different, they do have one common factor in that they are all public health issues or public health concerns that we have all dealt with just from living in the Central Valley.
So we're here from UCLA to entertain you with the idea of pursuing a career in public health. We're going to go over what public health is, where it is, why the work we do is so important, different trajectories within the field, careers, and to showcase this opportunity that Dr. Barron was talking about that's really exciting that's happening at UCLA this coming summer. So I'm Lindsay Rice. I'm a program manager at the School of Public Health. And this is Saul Garcia. He's a UCLA graduate, a former Central Valley resident, a master's in public health student, and my former research assistant and program assistant for a project we're finishing up right now.
And so
before we hear from Saul and what led him to pursuing a degree in public health, I just want to take a minute to define health. The World Health Organization defines health as a state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity. The health of Americans is in need of improvement. The United States ranks last among high-income countries in preventable deaths. If the U.S. matched the performance of the top 3 nations, we would save 100,000 lives a year. And it's more than just saving lives, it's also quality of life. Today's society has people working long hours for low pay, not eating well-balanced whole foods, not exercising adequately, and incredibly stressed. So we just want Saul to go over his path and his family experience and what led him to pursue a career in public health.
So let me go ahead and set the background for y'all. Saul was senior in Maria Tinajero in Mexico, fell in love, got married, decided they want to have a family, but they both came to the understanding that they thought it'd be a little better if they had their family in the United States. So they kind of dropped everything, left behind their family and friends, and they came to the United States. And they had 2 children, a nice family, and they had a lot of accomplishments along the way. Top left picture, you see my dad's ID on the bottom. Mine is on the top. He became a member of the United Farm Workers Association. On the right, you see my dad holding my sister with my grandpa right next to him on the right as they both became U.S. citizens. So they did a lot for us to put me in a better position to have a better shot, have a better life. But at the same time, I also saw them make a lot of sacrifices. So you see my dad on the left standing on a tractor. He works for, I don't know if you ever heard of J.G. Boswell, large agricultural company. And that's during one of their 12-hour shifts during the cotton season, which puts him in a lot of physical stress, a lot of physical health risks. On the right, you see my mom on the bottom left with her 2 friends during their lunch break. And although they look very happy, she used to complain a lot about consecutive shifts back to back. putting in a lot of stress, standing up, unfair working conditions. And although they did this to put me in a better position, I did see that they sacrificed specifically their health and their well-being, and that's something that I kind of carried with me as I've gone to this point in my life. And you see me on the left, graduated from high school, going to UCLA, thank the Lord, but I didn't really know what I wanted to study. I know I wanted to give back, but I didn't know how that would work, but I wanted that to be involved in some way. And so my cousin, she suggested pre-med, and I looked at the schedule and I was like, you know what, I don't think that's for me. Looked a little hard, so I was like, let's try something else. But luckily, after my first year as an undergrad, I got the opportunity to work at an organization called Fitted. Originally, I didn't want to do it because it looked like a lot of work, and there's a facility on campus where you can work and meet a bunch of NBA players. So as a 17-year-old, that's kind of my priority, right? I'm trying to meet some big ballers. But luckily, I was encouraged to apply to Fitted. I ended up loving it, primarily because I was able to work with people who look just like my mom and dad, just like the communities I came with, and I was able to make a big impact on their life immediately. And so once I graduated, I really craved that job. I wanted to do something just like that, but I had no idea how, if that even existed, right? And when I graduated, I was looking for jobs. I was looking for something to do, right? I was able to work at UCLA Recreation as a trainer, getting people to transition from no physical activity to a physically active lifestyle. From there, I worked at what's called the UCLA Healthy Campus Initiative. And I was working as a field coordinator going to 20 different daycare centers, measuring the heights and weights of 3 to 5-year-olds. And through a little bit of hard work and determination, the head researcher there connected me to the faculty member who was actually heading this training program. And that's where I was able to work with Lindsay, doing some more research. But all those work experiences are what kind of guided me and carved my path. And so now that I'm in grad school, I'm really thankful for those work experiences because, again, it kind of guided me and it showed me what I really wanted to do, specifically advocacy work. So at the UCLA School of Public Health, they have a public health advocacy fellowship. Now, advocacy might seem a little blurry to you, but this fellowship really helped me understand what that meant. I'm currently working at I guess you could say it's like a nonprofit that works with housing rates in Los Angeles. Housing was something I struggled a lot with, specifically housing quality as I was growing up, especially in Los Angeles where they have really high rents and it gets really difficult. But with the work experience and the skills that I developed throughout my years, as well as being able to tie in my passion and getting that hands-on training, as well as developing those skills, I've carved this path where now I see myself really working in advocacy work because I want to speak up for people that I feel may not have a voice.
So we are incredibly lucky, as you can tell, to have Saul at the School of Public Health. I'm a first-generation college student myself, and I'm incredibly passionate about introducing people to careers where they can make a lasting impact and really serve vulnerable populations that are typically underprivileged and underserved. And these things that happen to people that are in vulnerable situations don't come out of the blue. They're happening across the board. And health disparities can often be explained through the socio-ecological model, which we get into in a grad school program in public health. But the conditions are ingrained at various levels, and they often impact directly individual choice and health. Disparities are defined by Healthy People 2010 as the differences that occur by gender, race or ethnicity, education or income, disability, living in rural localities, or sexual orientation. So there are many public health organizations and agencies that work to promote health and decrease health disparities. As researchers and practitioners in the field of public health, we spend a lot of time working to understand the issues and develop interventions that might positively impact the health of vulnerable populations and people that are typically underserved and underrepresented. Some of the organizations we partner with that our students have field studies with, our students in the advocacy program work with, are Peace Over Violence, the California Endowment for Healthy Communities, Valley Family Center, Los Angeles Unified School District, the LA County Department of Public Health, Latinas for Reproductive Justice, Sunshine Landfill, Project Angel Food, Homeboy Industries, the list goes on. Public health is everywhere and embedded in so many local organizations. So, people that work for these organizations in public health come from a variety of personal and educational backgrounds. I think what I love most about public health is having people that got their undergraduate degree in psychology, international development, math, whatever it may be, anthropology, sitting around a table in a master's program or in a research team talking about solutions to public health. And it's incredibly innovative and diverse, and it really helps us think about these problems in a more holistic way. We have faculty that specialize in epidemiology, community health science, biostatistics, environmental health, and health policy and management. So what we're trying to say with all of this is that if you want to positively contribute to society, public health could be right for you. Well, I can go into the many different subspecialties and specialties of the master's program and career paths. I don't totally have time today, but I invite you to reach out to me at any point if you'd like to talk more about it. Sewell is also offered to be a contact for you if you want to further explore what careers in public health look like. And it looks like Dr. Barron also has some things on the website. So what we're really here for today is to talk about the UCLA Public Health Scholars training program. So this is a new exciting opportunity. We were funded by the Centers for Disease Control to host students every summer for an 8-week summer training program where we'll have 3 days of internship opportunities in the field, some of the organizations that I just mentioned, plus more. And students will have a field mentor preceptor where they will work hands-on with different public health issues. And then 2 days a week, we'll have seminars and educational development, leadership training, professional development workshops on campus at UCLA. And some evenings, weekends, some fun stuff that we really are hoping to expose people that are, maybe they think they're thinking about a career in public health, maybe they're not. And I know the hard sciences are incredibly important and valuable when you're talking about studying epidemiology or biostatistics or understanding some of these issues. However, it's not closed to those people. It's also open to people that are doing sociology, psychology, anthropology, whatever might be right for you. And so there's no limits there. I just want to give some specifics about the program if you are interested. So it's an 8-week summer training program. You would have to be committed between June 24th and August 17th to those 8 weeks of the intensive program. You would intern with a partnering organization, as I mentioned. We would do the 2 days a week of the educational, professional leadership development. The program provides a $3,000 stipend, housing on campus meals, and a Metro Pass for living in Los Angeles for those 8 weeks. Also, the Centers for Disease Control wants everyone that's a public health scholar, there's 4 other institutions across the nation, to come to the CDC for a 3-day workshop and experience with all of the other people that are public health scholars through this funded program. And scholars may, it depends on where you're coming from and commuting, may qualify and be able to apply for some funding to get to and from the program. Eligibility criteria, so interest in exploring a field in public health, ability to be in Los Angeles during the time that I mentioned before, completed 2 years of an undergraduate education. So being at Bakersfield College right now, I know it's not a 4-year institution, but some of you might be transferring in the next year. So as long as you had that confirmed at that point before you started the program, you would be eligible. If you're not ready for that yet, this is a 5-year program, so it could always be next year or the year after, whatever might be coming up next. We do not have a GPA requirement currently, so we just welcome people to apply. And evenings, weekends, I mentioned that, and then successful, you'd have to submit all of your application materials. The application process, the application isn't live right now, but it will be very clear what you'll need to do. And it will be transcripts, a couple letters of recommendation, and what else, I guess, oh, a personal statement. So yeah, the way it's gonna go is step 1, you'll complete the online application, which will be live mid-November, and Dr. Barron will be able to forward that information on to anyone that's interested. step, just so you know when it's live, it will be live through the end of January though. So through January 31st, and there's no preference if you apply November 15th or January 30th, it doesn't matter. We'll be reviewing applications in February. So the online group interviews, you would be invited to do a group interview, and we would do it online where you'd be able to kind of interact with the other people that are on your group interview. And then scholars will be notified of acceptance. I just kind of want to go back to the group interview thing for a second, in that the reason why we would do something like this is because this is an opportunity to be part of something bigger. And what we're really looking to do is develop a fellowship and an opportunity for people that are in this and want to be in it and continue to grow in the field. And so you'll have faculty mentors, you'll have students that are getting their master's in public health currently at UCLA as mentors, and your preceptors in the field as a mentor. So ideally, we'd be really setting you up for a successful career in public health to either get a graduate degree, jump right into the workforce, go on to do a PhD, whatever that might be. So yeah, I actually don't have my master's in public health. I have my master's in social work. And then Saul is the MPH candidate here. Here's our contact information, and that's it for today.
Great. Now, I'm going to post all these PowerPoints up on the website, right? And also, we've been Zooming this so that it's been recorded. But before, we left a lot of time at the end. I just want to kind of go around the room. And I want to start off with Matt, because I know Matt's the director of public health, and we've talked about this. Why is it so important, Matt, for careers locally? Why have a public health program here? What kind of people are you looking for at public health? Yeah.
Okay, so thanks for letting me be here. Of course, if you don't know, Sarah Barron, boy, she is just a firestorm of activity, isn't she? She's the reason we're all here today, and I will follow her wherever she is, and I'm going to support her because she's helping train you and foster this discussion. So at Kern County Public Health, we have a desperate need for all kinds of professionals in all kinds of these fields. Public health is made up of environmental health, emergency medical services, and the traditional public health division. We are tasked with protecting your health and safety. That's what we do in Kern County. There are a tremendous number of opportunities. We are hiring all the time. Even though we've had some downturn in the economy and we're being careful on how we spend our money, all of our money, almost all of it, goes to providing salaries for our amazing employees so that they can go out and make this place a better place to live. As you know, there's a lot of challenges that we face in Kern County, from the economy and transportation needs, the environment. We struggle at some of those. But we're making significant improvements, and we're looking for people that want to come and make a difference. We need you to have the education, and we need you to have the background, but we want you to have that passion, that drive to make a difference in our community. I can't train that. I can't teach that. You really can't learn that. You need to learn the education and the background so you can come apply it. But like Saul was telling us, I need people born in the Central Valley that want to stay here and make a difference. Yes, we'll take people from the outside. I wasn't technically born in the Central Valley, but my wife was, and we're raising the fifth generation that was born in Bakersfield. So I count myself as truly somebody that cares about the Central Valley. So we're here to help you in your endeavors as you proceed down this way. As I told Sal, if there's projects that you want to work on, if there's ideas or internships or volunteer opportunities you need, you come to me. We're going to provide that to you, because I think once you get exposed, you're going to want to apply the knowledge that you're gaining. And there's only a few places you can gain that knowledge. This offer from UCLA is pretty amazing. There's not many of those. So, take advantage of it, but stay committed. Look for these opportunities. You'll find them. What else do you need me to cover, Sarah?
Perfect. Thank you. So that's locally here you can make a difference. I know that I'm excited about what CSUB has in plan for the future for public health. I know Ed Rangel has been involved with the hackathon with his computer science, been very involved in developing an app right now. You guys are working on Building Healthy Communities app?
Yeah, so the project came out of our public health hackathon that we hosted on campus in the spring semester. and one of the community partners, Building Healthy Communities, had a problem that they wanted to kind of solve. The problem was trying to communicate effectively with all of their community members, right? A lot of people live in the South Kern, part of the Valley, and Building Healthy Communities wanted an effective way to pass information, not only to the community members, but help open up channels within their staff as well. So the solution that we're trying to provide them right now is developing a mobile app. A lot of us have these devices that we're constantly connected to, and so the app will connect not only the community members who live in the region, but it'll connect back to the staff members in Building Healthy Communities. So we received a grant, and the grant is funding work experience and internships for our students on campus. So I have several computer science majors that I'm working with currently. I'm kind of like their lead software engineer, their mentor, providing them the tools and expertise, right? Because these are students here at BC2 who have only taken maybe a year or two of computer science classes, so they don't necessarily have the full, skill set needed to take an idea or a solution from idea to implementation. So I'm kind of here helping them along with all of their technical challenges. So that's what we're doing in the computer science department, helping and supporting public health, right? Because County of Kern, right, City of Bakersfield, we all have these needs, and we all need the technology that sits on top of that stuff. So that's what the technologists are doing.
And then technology is very big, and Asha's Chandis from Building Healthy Communities here, and so representing the grassroots, and you can talk to her a little bit about what's going on here. Dignity's here too. We're talking about certificate of achievements and kind of networking and internships. Who else is in the room? Let's see, we got Michelle? Catherine.
University of Laverne.
Yeah, University of Laverne. You're really thinking about the four-way pathway, right? Totally my main thing, sorry. So I want you guys to kind of take an opportunity to talk to the people, go up afterwards, because I know a lot of times you might have questions that you have for the entire group. I'm going to give you a couple of minutes to do that now. If you have a big burning question that I'm sure other people want to know, or you can go up individually to people and ask them too. So let's open it up to questions right now. Any burning questions for the whole entire group?
Can this also, can this also apply to veterinary sciences?
That's a good question. Veterinary sciences. And in what way? Like being a major that you transfer in, you focus in on public health, like you do 2 years veterinary science here, and then transfer. Do you have like required courses? Probably public health science type courses or what?
No.
No? Okay, right.
No.
So the answer would be?
The answer would be you're eligible and you should apply. And if you think that it, in a bigger picture way, applies to public health and your career looks like it would be going in a direction where learning about public health would benefit that and you would be able to contribute back to population health, animals are included in that. I mean, environmental health, like a lot of things affect animals too, so you're not discriminating.
Yeah, no, and you're in my public health class, I'm constantly talking about vectors. So, but they're good. I love my dogs too. But yeah,
it is competitive, I will say it is competitive. So you want to market yourself as a person that would be right for this program and why public health is, important to you. That's what I would say.
I mean, as long as you can build a connection between what you want to do in public health, that's very. I got a degree in psychology, but I connected it with public health because I saw how that connection kind of unfolded itself. So maybe you want to work with veterinarian, helping people get pets if they have mental health issues or something. That's your passion. That's very public health. So if you if you can kind of have ideas like that, that'd be incredible. But maybe you just want to explore something too. You're in medicine and veterinary sciences, but you're maybe let's see what else health has to offer. That's also.
It's also sanitation. There's so much.
Yeah, that's
so many questions. I have one back here, and Vanessa, and then Eddie. Do you have a question?
My question was, how many participants are there usually each summer? And from what type of institutions are you?
Yeah, so it's a national program, and this is our first year. There's 4 other schools that have had the program for several years. UCLA, this is our first year doing it, and so we'll have 35 slots this coming summer. So I did say it was competitive. However, there's other programs. So if you go onto the CDC website, it's called the CDC Cups program. There's also other institutions too. Just open, broaden your search with looking into that. And then every year we have 5 years currently of funding, and so we're going to try to increase the number of students every year. And we're looking for other funding sources to be able to provide more opportunities for more students. We have the capacity from a programmatic side to have 50, but we don't have the funding for 50 scholars every year.
I know you said it's nationwide, but since you're looking for more local, are you maybe would
We are
California
giving preference to
applicants-
California.
Okay.
We understand and care deeply about the need in the Central Valley and the rural communities up here. There are large health disparities and a really large need for the public health workforce. And it is our mission to help develop the next generation of the public health workforce. That's what we've been charged to do with the CDC. So while people will not be excluded from being national,
Right.
living in Alabama or Mississippi or wherever they might be, and that will bring some nice diversity to the program. We are heavily recruiting in Central California.
Awesome.
Eddie.
I had a question. So we have a lot of veterans on campus.
Uh-huh.
We have a lot of veterans on campus that are trying to find out ways to help their fellow veterans. I know of one specifically who's kind of looking for a program to do that. From what this gentleman was sharing, it kind of seems like this would be a good fit, right? In our Central Valley, in our area, trying to help the veterans in our area.
Yeah.
Typically, we don't necessarily have the resources of big cities, right? Especially when we're trying to bring, we're getting inundated with veterans right now, right?
Yeah.
And sometimes our county doesn't necessarily have all the resources. So, like I said, this sounds like something that we can point maybe some veterans at too. Yeah. Is there any specific help, I guess, for veterans explicitly in your programs? Or?
Nothing specific separately because it's a government-funded program, so anything that they would get probably through the VA and then combined with what the program offers, I would imagine. And I'm also willing to have a conversation with them and to see where we are. I don't know totally, but we're open-minded to
So that's a
exploring.
public health issue, right?
It's a public health issue. I'd also say this program is great for it, but I would love to connect with you. And also we have tons of master's students that are so interested, and a lot of them actually, come from the Central Valley, come from all over. So we've been brainstorming a little bit about this with Sarah too. We shouldn't limit ourselves to this program. It's awesome, but we can partner more with some other things that are going on.
That's a perfect segue for the last, I think the kind of to wrap it up with a bow is that, with public health, there's a lot of different options. You can have, I was a Latin American studies major with a minor in Spanish, and then I started my public health undergrad. So I encourage you just to, you can have your major and take public health classes and sprinkle it in with a certificate of achievement. You can make public health your central focus and make it your major. But we're a very divergent group of people where our brains go everywhere. We like to think about anthropology. We like to think about psychology. We like to work with computer science people. We work with juvenile justice. So if you feel like it's not a track where you sign up for one pathway and it goes like this, you have to understand it's very divergent. So I encourage you to kind of look at it as a way to kind of open your minds to a lot of different career paths that we could look into here at BC with the Certificate of Achievement and the future pathway to CSUB with the AST, the Associate Science Transfer degree, and then this opportunity with UCLA. And I see future research projects coming out of UCLA and having maybe some internships that we could foster here too. So with that though, I'd like you to definitely talk to people. There's food. We have some food. So go grab some food, and then we're gonna start the next session at 11:15, but stay around and talk a little, okay? Great, thank you for coming. All right, good. So you can sing, yeah, you can have lunch too.
That's the only reason why we came.
That's sandwiches. They're lovely. Can you see what it's, they're cafeteria. Yeah.